Hi, everyone. Thank you so much for joining us today here at YouTube, I'm sorry, at UWorld on YouTube. I am here to talk to you about everything NGN, Next Generation NCLEX. What I would like to do today is give you some new information if you haven't gotten it already. I'd like to dispel some myths and give you some tips for how you might do your absolute best and shoot for success on the NGN NCLEX. I'm here today with some of my colleagues, and as we go through the discussion, they will be taking questions in the chat. So if you've got a question, please enter it in the chat, and they will either respond to you right away or they will give the question to me to answer to everyone. My name is Karen Sutherland. I am the Director of Nursing Education here at UWorld. I have a lot of testing experience, almost 20 years actually. I'm also a nurse and have practiced and have done some work with the NCLEX in the past. So let's get started. The first thing that I want to tell you, and I want to dispel a myth initially. The Next Generation NCLEX is not a new test. What it is it's a revised version of the NCLEX that you're already taking. So now in the lead up to this launch date of April 1st of 2023, we are calling it the NGN exam, but really it's going to revert back to just the plain old NCLEX in the future. But for now, we're going to refer to it as the NGN because a lot of what we're going to talk about today are the changes that are being made to the existing exam that'll be launched on April 1st, 2023. So that should give you a little bit of a tip right off the top that since it's the existing NCLEX that's simply being revised, that a lot of the exam is going to stay the same. So there will be some changes, but a lot of what is already administered will still be administered. This is going to affect both PN and RN students, so everybody that is in school now to become a nurse will take the revised version of the NCLEX or the NGN. It goes live on April 1st of 2023. So if you take it on or after April 1st, you'll see the new exam with the new items in it. But don't forget retesters. So if you take the exam prior to April 1st, and if for some reason you're not successful, then your retake, if it falls April 1st or out further than that, you'll be taking the new NCLEX. So it would probably behoove everybody to listen and kind of understand this a little bit better. So what exactly is changing? There's been a lot of information out there on social media platforms. There's been a lot of information that has been imparted by a lot of different sources. But there's really three basic changes, and so let's just keep it simple. It's probably the easiest way to do this. The first thing is that this whole new premise and all of these revisions are based on something new that's called the NCSBN Clinical Judgment Measurement Model. So we're going to abbreviate that CJMM for now. And this is a new model that's come out, and I'm going to talk a lot more about that in just a little bit. But that's the first thing. The second thing is, keep in mind that this is the revised NCLEX. So there's traditional test questions. I may say items instead of questions, so I want you to know that item is it's a business industry term, but it means questions. So we've got traditional questions plus new types of questions that we're going to call the NGN questions. And I will show you some examples of what these are and talk more about that in a little bit. The third thing that I think is really intriguing and really beneficial for students is that they are starting to implement partial credit scoring for some of the questions. This has been something that students and faculty have asked for a long, long time. And the research that the National Council has done has borne out that this is a good change to make. So this should benefit everybody. It shouldn't hurt anyone. It should always just benefit you. And again, I will go more deeply into that in just a little bit. So to begin with, why did they do this? What was the whole point behind all of this? Well, in 2014, one of the Board of Nursing representatives at one of the meetings for National Council put forth a question that said, are we measuring what we think we should be measuring? And what happened is they took a look at the types of questions that were being used on the NCLEX, and they did a survey of employers and faculty and everybody that's involved in the nursing industry. And what they said is that new students are lacking in clinical judgment when they enter the profession. So what they said is, well, are the questions that are currently on the exam measuring clinical judgment fully for entry-level nurses? Now, this is to better measure clinical judgment. The existing questions do measure clinical judgment, but not in the same way. So what they did is they decided that they were going to embark on this very, very long, involved, and expensive project to try to make the revisions that make sense to better estimate who should be in clinical practice and who shouldn't. So I said before that this affects both RNs and PNs. So both will see these new NGN items on their exams after April 1st. There was a lot of research that's gone into this, and I can tell you there are some landmark papers if you're interested in reading them to get more background on exactly what this model is and why they did this and how this aligns with the practice. And I would suggest that you go to NCSBN.org, which is the National Council State Boards of Nursing website, and everything is there. It's an excellent resource. So the other part of this is that the basis for the measurement model is to enhance measurement of clinical judgment. So what does that mean? So this is the model, and if you look here on the left in the different shades of green, let me see if I can get my mouse to work. There we go. So don't focus on the purple yet, just go to the green. So the green starts at the very top with recognize cues, goes all the way down through evaluate outcomes. So what you're seeing here is this model has come into play as a way to measure your thinking as you go through the nursing process, which is on the right in the purple. So you see they align pretty closely with each other. So let me give you some examples. So everything starts with recognizing cues, and you know that as part of your assessment. You've learned that in school. So when you recognize cues, somebody comes in to a clinic, to an emergency room, to a hospital, and there's something wrong. And it's you that has to figure out what are the cues or what are the clues that tell you that there's a problem. Are the vital signs off? Are they having pain? Do they have a rash? Whatever. So what you do then is you analyze those cues. So you think about it. Okay, so this is what I see. This is what I think is important. So what does that mean to me? So I'm analyzing those cues. Then you try to think, well, what does this all mean? So what do I think is wrong with this patient? What do I need to do? If somebody comes in and they're coughing and they've got a history of, they come in and their family member has COVID, you're prioritizing your hypothesis and you're thinking, well, gee, maybe they have COVID too, so what should I do about that? That should generate solutions. So you know immediately that you have to protect yourself and everybody else from this patient, so you're taking action. You're putting on PPE, you're getting ready to take care of the patient, and then you are deciding at the end of that, are you prepared now to go in and take care of that patient? Now you circle back and you go back to your cues again and you'd think, well, I'm pretty sure that they've got COVID, and then you kind of go through the model again. So what am I going to do for them in terms of nursing care? And you go through and you keep circling back. So the whole model is a cycle. The part that I've showed you here today is called layer 3 of the model. There's 4 layers in the original model that was developed. And when you take a look at it at the ncsbn.org website, you'll see that layer 3 aligns very, very closely with the items that you're going to see that we're calling the new next generation items. But in order to keep this as simple as possible, align it in your head with the nursing process. So as you go through the nursing process, you see that it follows these 6 steps in the clinical measurement model. So don't make it harder than it needs to be. What they're doing is they've broken down the nursing process into these 6 steps, and each of these 6 steps presents a measurement point. So it's a point that we can collect data from the exam to determine how successful you will be as a new nurse. It's a predictor. Are we getting any questions about that? Okay. This might take you a little bit to digest. It is a little bit complex and it's new. Anything that's new takes a little time to adjust to, but take your time, look through it, and focus on what the 6 steps are, learn what the names of the steps are, and always remember that the steps always go in sequential order. So you have to recognize the cues before you can analyze them. You can't evaluate an outcome if you don't even know what you're evaluating. So it should make sense to you, it should follow the nursing process, and eventually it'll become very intuitive to you. Okay, if there's no questions, we'll move forward. So what exactly are these question types? There's a very complex way to look at this, and then there's a simple way. So we at UWorld believe simple is best always, and so we have broken these down into 2 categories. There are standalone questions, and a standalone question means it's just a single question, just one question. And honestly, everybody is used to on a test where you take the test and you get a question, and it's a single question. But they're calling these standalone questions, okay? So it's just a new term for something that you already know and that you're already comfortable with. And with these new NGN standalone questions, they are written so that they can measure one or more of the steps, those 6 steps that we just went through in the clinical judgment measurement model, okay? They can be any question on the exam, including traditional NCLEX questions, except for case studies. And we'll clarify that in just a little bit. Now, case studies also are another type of NGN question. So we have the standalones, which are single, and we have case studies. And a case study is new to the to NCLEX. Probably not so new to you, though. You've probably done this at some point in time in your career, or in your maybe even in your education. So a case study is simply you receive a lot of information initially. You may see exhibits. You might see a vital signs exhibit. You might see laboratory results. You might see a history and physical, lots of different information. Very analogous to what you would see when you're going to the hospital with your clinical students. So you're going to see all of this information, and then you're going to receive 6 questions that relate back to all of that information that you had at the very beginning of the question. You will have access to all of that information throughout each of the 6 questions. Okay, so you don't have to worry about memorizing it all, or that you're going to miss something, or that you're not going to be able to go back and see it. So it will follow through in all 6 of the questions. And remember what I said about the clinical judgment measurement model. All of the 6 steps are there in a case study, and they're all sequential. So your first question will always be about recognizing cues. The second one will always be about analyzing cues. And it goes all the way through there to evaluate outcomes at the very end. So if you can get that, the measurement model, the green and the purple, if you can get that in your head, I think you'll have a lot more success at this, and it will alleviate your anxiety tremendously. So the case studies will have the 6 sequential standalone questions that follow each other, and they can be any question except what we're calling the bow tie. The bow tie is a brand new type of item or question, and I will talk more about that in a little bit. But just remember, for simplicity's sake, anything can appear in a case study except for a bow tie. It can be a traditional item, can be an NGN item, just not a bow tie. We good so far? Okay, so now don't panic. I put this slide up not to intimidate anybody or provide a lot of confusion, but what I want to show you is these are the names of all of the new item types and some of the traditional item types that will be on the NCLEX that you may see when you take your NGN exam. And what I did here is I divided it into 3 categories because there really are just 3 categories. So again, keep it simple. So there's some industry terminology here, and I don't really want you to focus on that. So for example, drop-down close, C-L-O-Z-E, that's a new term. That's also, it's a testing industry term. Don't even think about it. What I need you to focus on right here is that there's 3 different types of items that you're going to need to answer and you're going to need to understand. The first one is choose N. What does choose N mean? Choose the right answer, choose the 3 right answers, choose the 5 right answers, whatever. And all of these different types that are listed below it will give you an opportunity to do that, and it's just in a little bit of a different format. And I have to be really honest with you. I'm pretty sure that when you've gone for a driver's license or you've filled out an application, you have used almost every one of these item types. I don't think many of these are going to be that unfamiliar to you. They just have fancy names. The second item type is relevant versus irrelevant. And what that means is that you are going to be asked to look at information and you're going to pick what's relevant versus what's irrelevant. So what does that go back to? What did we talk about that actually fits really well? How about recognize cues? Recognize cues. So you're going to read through a passage and you're going to pick out what's relevant versus what's irrelevant. So that's an example. And if you look there, it says highlight text. That could be an admission history. I developed a fever last night. I came into the hospital. I took my dog for a walk yesterday. I went shopping and I bought a dress. I had a rash that developed, et cetera, et cetera. So what's important there? Well, the important part is, you had a fever, you had a rash. It's not really important to know that you took your dog for a walk or you went shopping. So you're picking the relevant from the irrelevant. And then all you're doing is you're just highlighting what's relevant. So what does that sound like? That sounds an awful lot like a SATA or a select all that apply to me. So that is the second category. The third is a little bit new, and the third is called justification, and sometimes when we get to the scoring, it's also called rationale. So this is simply fill in the blanks. That's all it is close equals fill in the blank. So the patient has X because of Y. That's all it is. And you can have the patient has X because of Y and Z, or you can just have the 2 fill in the blank spots. So don't make it harder than it is. The close items equal drag and drop. Any questions?
Yes. One of our candidates or one of our users is wondering, wants more information about bow tie items.
Hang on to that. I will get to that in a little bit. Bow tie items, they look like a bow tie when they're written out, and that's how they got the name. But I'm not going to say anything else just yet, so just hold on to that question. Anything else? All right, so from the page that I just showed you, this is the simplistic way to look at it. Everything that was on the previous page is on this page. So if you really want to learn what the item types are and you want to know where you might see one, this is probably the way to do it. All right, this doesn't have all the industry terminology in here, and it's just, it's a lot simpler. So if you look here, multiple choice. A multiple choice question is something that everybody is used to. And that could be given as a standalone question, it could be an NCLEX style question, or it could be in a case study. So you could see that in either of those 2 situations. The same thing for multiple response, and you can have the SATAs where it's select all that apply. And what's new to the NCLEX now, as the NGN, is the select N. So traditionally, you've been asked to select all that apply, and you've not been given any further direction. Now you have the direction in some of the questions, not all, but some. And these are select N, meaning select 2, select 3, select 5, whatever. So that'll tell you how many you need to select. And you need to select that number so that you can get full credit for the question. We have drop-downs, which are simply fill in the blanks or close, as I said earlier, but let's just call it fill in the blank. There's drag and drops where you put the cursor on a box on the left and you drag it to the right place on the right column. Highlight text, which I talked about a little bit before. The rationale, fill in the blanks. All of these can be either seen as standalone questions or in a case study. The bow ties are different. The bow tie you will only see as a standalone NGN question. And the bow ties are a little bit more complex, and that is the reason that they are not seen in the case study. Also because a bow tie gives the NCSBN the ability to measure all 6 clinical judgments measurement model steps in a single item. So remember, the case study measures all 6 steps because it's a case study. So it doesn't make any sense to have a bow tie in a case study, right? Because a bow tie would be a single item that measures all 6 steps. So it just doesn't fit. So the bow ties are the only ones that you'll see simply as just a standalone. Everything else can be either a standalone or in a case study. Good? All right, so let's get down to it. What's not changing? So the parts that are not changing is the time to test. You still have 5 hours to take the test. So your first question to me should be, well, that doesn't make any sense because these questions, because there's more to do, they should take longer, et cetera, et cetera, et cetera. Well, that's what they thought too. And when they did the testing, and they tested in, I want to say, hundreds of thousands of users, what they found is that the time to answer an NGN type question is no different than it takes to answer a traditional NCLEX question. I was surprised, they were surprised, but there's a lot of data to support that. So the average person takes about 2 hours maybe to take the NCLEX. So you figure there's a 3-hour cushion for everybody to use to take your time, read the questions, and spend as much time as you feel like you need on these NGN type questions. So the 5 hours is still the same, no change there. They're still delivered by the CAT, the Computer Adaptive Test Delivery System. So that means that it's an adaptive test. I don't know that we have the time to go through what the CAT exam actually is, but we can maybe do that in a subsequent webinar or YouTube discussion. But CAT delivery means that it's an adaptive exam and it's delivered to each person as a unique exam. So whatever your ability is, the exam estimates that ability. After the first question that you answer, after the second, after the third, it continuously re-estimates every time you answer a question, and that's why it delivers you a unique exam. Because if your ability level is high, then you'll be given questions that give you an opportunity to be challenged at that level, and if your ability level is closer to the passing score, then you'll receive questions that are at that level as well. So that's not changing. Everything that you knew about CAT exams is still the same. The stopping rules are still the same. You can find these on the NCSBN website. What that means is when the computer is going to turn off. So whether you know if you passed or you failed, at that point when the computer has made a decision of whether you are competent, it will stop administering questions and it'll shut off, and then you'll receive a score. Typically, if you have a short exam, you can estimate that you were either high above or far below the passing line. If you have a longer exam, all that means is that your ability estimate is closer to the passing score, and it means that it took more questions in order for the algorithm to be confident that you are competent to practice. So everybody that passes is eligible for practice. They're competent to practice. Doesn't matter if it shuts off sooner, doesn't matter if it shuts off later. You either pass or you fail, and that's all the information that you will receive from the NCSBN in your score report. There's a similar number of questions that are going to be delivered. It's not going to be very different than what people have already experienced. So if you talk to your friends and colleagues that have already taken it, the experience will be very similar. We'll get to the exact numbers in just a little bit. And you have to remember that every question should look challenging. So don't get discouraged and don't get frustrated. It's the nature of the CAT exam. Remember I said it delivers questions at your ability level. And when it estimates your ability level, it estimates that you have a 50% chance of getting that question right or of getting it wrong. So your ability level would be different than mine, then would be different than anybody else that you're, in your class. So there is a very, very, very large test bank of questions with questions at every ability level to deliver to everybody. Questions about any of that?
We're getting some questions about the breakdown of NGN item types versus traditional item types on the NGN and how.
Well, that's a really good question, and if you give me another two or three slides, I will be able to answer that for you.
The other question we're getting is on the level of difficulty for next-gen questions. Are next-gen questions more difficult or the same level of difficulty as the current questions on the NCLEX?
That's actually a really good question, and it all goes back to the CAT exam. Remember I said that every question is delivered at your ability level. So every single question on the NCLEX, whether it's traditional or whether it's NGN, has been what we call pre-tested or field tested. So that means as soon as it's been created by the National Council, it goes into the exam pool as what we call an unscored question. And if you look at the slide that I've got up now, for the unscored questions, 15 of those questions that are currently on the NCLEX are unscored or pretest items where they collect the data to determine where do these questions fall in terms of difficulty. So when those come back in to be analyzed after hundreds of people have taken the question, the psychometricians at the National Council analyze the data, and they look to see where does that item fall within the difficulty level of everything else that they've seen. And if it fits the statistical parameters and the question falls within a spectrum that's acceptable, that runs from very, very easy to very, very difficult, they will know where it sits on that line. So it could be a very, very difficult question, but only people that are at that ability level will see that question. So if you're closer to what we call the passing standard or the cut score, you're not even going to see that question. You might see it as an unscored item when you're taking your test because they're kind of peppered in so that you don't know which ones are scored and which ones are unscored. The reason for that is so that you take every question seriously and you answer it as though your life depended on it, kind of. So there's 15 of those currently in the NCLEX, and there's 15 that are going to be on the NGN or revised NCLEX. So you don't know where they're at. Those come out, they get scored. Once they're scored, or not scored, they're analyzed for statistics. Once they're determined where they fall, then they go into the bucket of difficulty where they're at. So I have a very hard bucket on my far right. I have some that are kind of right around the passing score. I have a bucket that's very, very easy on my left. And so in between there is a spectrum where everything else falls. So depending on where my ability level is, will determine what item I am delivered next. So it's configured the same way for NGN as it has been for the NCLEX for as many years as the NCLEX has been being delivered. Nothing different there, nothing at all. Does that sound like it answered you? Okay. So let's take a look at this a little bit more closely. I'm contrasting here the current NCLEX with the NGN NCLEX. And if you look here, the total questions on the current NCLEX is 75 for a minimum length exam and 145 for a maximum length exam. The NGN is 85 for minimum length and 150 for maximum length. So you can see those are really pretty close. I mean, it's not too much different. So this is the total number of questions that you can receive. The minimum is 75, or I'm sorry, the minimum is 85 and the max is 150 on the NGN. That is scored and unscored questions. So remember, 15 of those are unscored. So that means that the scored will be 70 to 135. So 70 to 135 are scored questions that you will be, that will be used to configure whether you passed or you failed the exam. The 15 unscored questions will be unknown to you, and they will be dispersed within the questions that you receive. Now, for the NGN items, everybody, whether you take a minimum length exam or a maximum length exam, will receive exactly 3 case studies. 3 case studies. 3 case studies equals 18 questions. Because, remember back to our clinical judgment measurement model slide, each case study has 6 questions that follow the steps sequentially. So 3 times 6 is 18. 18 of the questions that you see will be part of one of 3 case studies. Is that clear to everybody? I hope. So, standalone items are everything else that you receive. Now, how many of those will be NGN? I'll answer in just a minute. I need to show you something else. But keep in mind that the case studies, there's always 3 case studies. Everybody gets 3. There is one exception to that, and that is if a case study is an unscored pretest item. So if you see 4 case studies, the most anybody would ever see would be 5. If you see anything over 3, that means that one of those case studies is an unscored case study. Will you know which one it is? No, you won't know. But you will definitely be scored on 3 case studies and 3 case studies alone, no more than that. We good? Okay, so how are these distributed on the exam? That's the question that everybody wants to know. The traditional questions follow the NCSBN test plan. I hope everybody is familiar with this. I'm going to jump ahead for 1 second here. This is the face page on the ncsbn.org web page. And if you go to NCLEX and other exams, and if you, I'm going to try to get my mouse to work here. I'm not having a lot of luck here. But if you were to, oh, I got it. Okay, so if you look here down towards the bottom, and it's not projecting. Anyway, if you look in the left-hand corner, lower corner, you'll see where it says test plans, and then there's a little arrow to the right. And if you expand that, that'll take you to the test plans. When you study for the NCLEX, the test plans are your friend. This whole website is your friend, actually. When you go to the test plans will tell you exactly what content to study. It will tell you what the question content is going to be on. Every question that's written, that's put on the NCLEX, NGN or regular, has been tracked back to the test plans. If the content is not in the test plan, it's not on the NCLEX. So that is a tip that everybody should follow. You should all be familiar with these test plans. They're on the NCSBN website, in addition to some frequently asked questions that are really valuable to go through. They'll alleviate your anxiety, answer some questions, et cetera, et cetera. I'm not here to plug NCSBN, but this is, this is the source. This is a true source. This gives you accurate information and current information. Lots of other resources there. So to go back to what we said, it follows the test plan distribution. So for those of you that are familiar with a test plan, there's a big, long, involved process that the National Council goes through. Actually, every testing, high-stakes test uses this model, where items are reviewed and committees are convened, and they decide, these are members of the profession, so these are practicing nurses that are clinically active, that are familiar with entry-level nurses. They work as entry-level nurses, they are an entry-level nurse, and they go through and they look at what is important for an entry-level nurse to understand. And they put together this test plan that's full of content that tells you all of the activities that are covered on the test. And then they decide how should it be weighted. So should we put more weighting on pharmacology, or should we put weighting on the management of care, or should we go to infection and disease control? So all of this is decided, and then it's published in these test plans. And every single exam that every single candidate receives, and all of the UWorld assessments that we administer, follow the weighting that is defined by the NCLEX test plans. So that is how all of the traditional questions will be delivered. And remember, I said the NCLEX, the NGN NCLEX is a revised NCLEX exam. So that means that the bulk of it really is going to be just the standard NCLEX traditional questions. So all of those traditional questions follow the weighting that you see in the test plans. Okay? Hopefully that's clear. Now the NGN questions, those are the ones you really want to know about. I've already told you that everybody gets 3 scored case studies, period, end of story. Everybody. So you'll see your 3 scored case studies, those are 18 questions. The next question that you probably want to know is, do they ever mix up those questions? Or do I ever see part of a case study? The answer is no to both of those. The case studies are fixed. And why is that? Well, it's because what I told you before. The 6 steps of the measurement model are sequential. They have to go from 1 to 6. So those are fixed. So the case studies that have been delivered as part of pre-testing items come back and they get a single ability estimate. So the case study itself is scored so that there's a single ability estimate that says, is the case study as a whole, is it high ability or is it low ability? And so that will determine which ones you receive as your scored case studies. So if you're a very high ability candidate, you're going to receive a case study that matches your ability score, your ability level. If you are a low ability candidate, you're going to receive something that would be much easier or much less difficult. So the case studies also have an ability estimate associated with them, just like every other question. The difference is the case study as a whole has an ability estimate, and that drives what question you receive next. Does that hopefully make sense? I'm not sure how to make that clearer, but we can certainly try if there's questions. The rest of the NGN items are standalone questions, and they can be NCLEX or NGN, but you'll see a variety of these questions distributed throughout the rest of the test, but these come at a fixed rate, and let me see where I'm at. We talked about that. Yeah, let me hold that for 1 second. This is a little bit of a busy slide, and I only included it because I'm hoping that if you are watching this, that maybe you'll pause and you'll read this, because I think this will make it a little bit clearer for you to understand. This sort of sums up what I've just been saying, but I'm going to add something for the second piece of it. So let's just go through the top part kind of quickly. For a minimum length exam with 70 scored questions, 18 are from the case studies, 3 case studies equals 18 questions, 52 will be NCLEX standalone questions, and 0 will be NGN standalone questions. So you should be saying, interesting. So what that means is that you will not even see one of the new NGN standalone item types if you get a minimum length exam. You will only see the case studies. This is taken from the NCSBN's, one of their latest news releases. It's the Next Generation NCLEX News, Winter 2022, page 9, if you want to read more about it. So you only see the NGN standalone questions, for example, the bow tie item, the fill-in-the-blank questions, if you take an exam that goes longer than the minimum length. So think about that for a second. Minimum length exam, 3 case studies, all the rest traditional stuff. If you exceed the 70 questions and your exam goes longer, which honestly almost everybody's does, then you will start to see some of these NGN standalone item types. So after the first 70 questions, the remaining 65 will be a combination of traditional and new standalone items. The way that this is calculated and how they are added to the exam is there is a fixed probability that about 10% of the remaining items that you receive will be standalone items. So let's take this example. If you receive the maximum length exam of 135 questions, your first 70 have 0 standalones, 3 case studies, traditional questions. The rest, the other 65, 10% of those, approximately, will be NGN standalones. So 10% of 65 would be 6 to 7 questions. So that tells you how many NGN standalone items you will see on your exam. Questions? Okay. Again, I wrote this a little bit more detailed so that you could focus on it, think about it, and then if you do have questions, we here at UWorld are always available to answer and clarify. Okay, so the next thing that everybody wants to know is how are these things scored? Everybody's heard that there's partial credit. This is a great thing. Everybody's excited about it. NCSBN is excited about it. So how are they scored? Currently on the NCLEX, they follow a model that's called a dichotomous scoring model. Big word, not important. What it means is that they're either scored as all right or all wrong. In a multiple choice question, that's pretty simple, that there's only there's only a single answer that's right, so you either get it right or you get it wrong. Where it kind of comes into play that it's a little bit more relevant to you is the SATA questions, the select all that apply or the multiple response, all names for the same thing. So if you have a multiple response question currently, and if there are 3 answers that are correct, you have to get all 3 in order to even get a point for the question. So if you get 2 of the 3, you get the whole question wrong. In addition, they don't tell you how many that you should be selecting. It's just select all that apply. So you don't know how many are right or wrong. And if you get, maybe 5 are right, and if you get 4 of the 5 right, you still get the question wrong. So that's changing. The NGN questions are now going to allow for partial credit for some of the questions. Now, the big one that people always ask about, and that's really important to mention so that you understand this clearly, is that if you have a traditional SATA question, select all that apply, will you get partial credit for that even though it's a traditional NCLEX item? The answer is yes. Beginning April 1st, 2023, all SATAs, whether it's Select N or just a SATA, select all that apply, will allow for partial credit. So that's a really great thing. So you can't miss there. So the thinking behind that is you may know some of it, but you might not know all of it, but you should get credit for what you know. So that's the reason that they've done that. So that's a really good thing, and that's been confusing for a lot of students, so I hope that that's clarified that for you. The case studies are fixed. I really kind of already explained that. The case study itself is delivered adaptively. The items or questions within a case study are not. So the questions within a case study, some might be easy, some might be hard, but when they all come together and get a single score, it's the case study itself that gets the score, not each item within it that gets a single or that gets a separate score. So hopefully that's clear. You can let us know if it's not. I also wanted to add that score reports are still going to be administered. You'll still receive a score report. The score reports are unchanged, except that they add a section about your performance on clinical judgment questions. Only people that fail the exam receive score reports. The reason for that is because the people that pass the exam don't need the score report because you've passed it. The people that didn't pass the exam use the information on the score reports to help to remediate, to study, the areas that you didn't do well in, help kind of guide your study and focus. Any questions so far? All right. So what are the scoring rules? How are they going to score this stuff? Now, I put this up because it's got the 3 categories, but don't pay attention to the item types so much as we have this discussion. Again, I just want to keep it really, really, really simple. This choose N column, where you're told how many answers you should select. Multiple choice, select N, select N for highlight, the bow tie. For the bow tie, you have to choose the items that, the items that fit into the different parts of the bow tie. All of these are scored as what we call 0-1. So you either get it right or you get it wrong. So the select N, where it's a multiple response select N, if you choose a right answer, you get a point. If you choose a wrong answer, you don't lose a point, you just don't get a point. So if you get 4 out of 5 correct, if it says select the 5 answers that are correct, and you choose 5 answers and only 4 of those are correct, you will get 4 points. You don't lose a point for the one that you got wrong. Now, when you see these, know that the computer will not let you move forward until you choose at least one answer. You cannot choose more than whatever the select N number is. So if it says select 3, you can't choose 4. It won't let you do that. But you got to choose something. So if it says choose 3, I would choose 3. You got to, with the partial scoring, there's no downside to that. Okay? So that's the 0-1 scoring. You get a point or you don't. Nothing's subtracted, just added. The middle column, where you're looking at relevant versus irrelevant, this is a little bit different. This is what they're calling plus-minus scoring. So that means that you get a point if you got it right, and you lose a point if you got it wrong. So let's use multiple response set as an example. So to prevent you from choosing everything, so if there's 10 answers and you choose all 10, and hoping that you're just going to get points for the ones that are right, it doesn't work that way. What happens is you get a point for what you got right, but you lose a point for what you got wrong. So if there were 4 correct and 6 incorrect, and you picked all of them, you would end up at a -2. Now, they're not going to subtract and go into negative numbers, so the lowest you can get is a 0. But you need to be careful with these because you can select as many as you want. The computer's not going to stop you, but the scoring will affect you. Is that clear? Okay, the rationale or justification is the third type, and these are probably the newest in terms of what you've seen on the exam. And these are the fill in the blanks. Remember, close is the same thing as fill in the blank. So this is if X happens, then Y results. If X happens, then Y and Z result. And these are scored a little bit differently. The bottom line here is you have to get the first part right in order to get any credit for the question, because you have to kind of understand it. It's a justification. So you have to know what you're talking about. You can't just make a guess. So if you get the first one right and the second one wrong, you can still get a point. Or I'm sorry, you get 0 points if it's the dyad, which means 2. Triad means 3. So if it's if X, then Y, and you get X wrong, and you get Y right, you're going to get a 0. If it's if X, then Y, and Z, you get X right, the first one, and you get one of the other 2 right, you'll get a point. If you get it all right, you'll get 2 points. So that's a little bit more complicated. And honestly, as a student that's going in to take NCLEX, the only thing that I would really focus on to not make myself crazy, because you don't have any control over how this is scored or how it isn't. You're trying to just get the right answers, is you know that there is the 0, 1, where you're going to have a limit on how many you can pick, and then the plus minus. So focus on those 2. The rationale is going to be scored the way it's scored, and I'm not sure that understanding that thoroughly is going to get you all that much bang for your buck. Are there any questions about this? Okay. So how should you prepare for the NCLEX? What's the best way to do this? Well, this is just a graphic that we created here at UWorld that shows that there's kind of this pyramid. And at the very base of the pyramid that kind of holds everything up are practice questions. If you don't use practice questions and challenge yourself and try to understand what you're going to be asked, then it's kind of like the whole base of the pyramid falls, and then you have nothing else. So it doesn't really matter if you do anything else. So practice questions are really, really, really the focus. It's not to say that you wouldn't want to use flashcards or anything else, but the practice questions should be the focus of what you do. It's one of our biggest focuses, is that the right word? Focuses here at UWorld. And we have question banks that are very, very big, and I'll talk a little bit more about that in a minute. But keep in mind that this is the base, and if you don't have the base, you really don't have much else. So you got to practice, and you got to practice with questions that are good, that are accurate, that are going to give you as much information as possible that you know that you can use as a foundation. So there have been studies that have shown that you can improve retention, which that means you can remember better, if you use practice questions and if you use quizzes and assessments. So we have the Q banks here at UWorld, and we have assessments that you can take here at UWorld. And we've got big banks for both RN and PN, and we certainly advocate that you would use both of these. You can increase your performance on the NCLEX by increasing the frequency in which you practice the questions. So that means that you need to have a big enough bank of questions so that you can practice them frequently, go over what you are weak in, and make sure that you cover the entire breadth of what you might be asked. And again, where would you find that? You'd find it in the test plan. You increase performance by the number of questions. The more questions that you answer and you practice with, the more likely to have success on the NCLEX. And the more similar the items are to the NCLEX also increases your performance. UWorld type questions mimic the NCLEX exam in the format, the color scheme, the feel, everything that you're going to take. So when you practice with UWorld type questions, you are essentially practicing with the actual exam. And so when you go to take the exam, that whole piece of the anxiety is removed for you. So you don't even have to deal with that. You feel like you're still practicing with UWorld questions because they look just like the NCLEX questions. And when you go to the NCSBN website, you'll see that because they've got some question formats that you'll see, they match ours. So focus on this, focus on practicing, and focus on the question banks. At UWorld for the RN question bank, QBank is question bank, we have 2,700 plus practice questions already there. But what I want to tell you is it's not just the practice question. All of the questions at UWorld include detailed rationales and performance tracking. So you can track your performance and you can understand why you got the right answer right or why you got it wrong and why the wrong answers are wrong. It's not simply, well, B, C, and D are wrong because they're not right. It's, B, C, and D are wrong because, and then there's a detailed explanation that follows that. So make sure you take a look at these. We have currently got 318 NGN style questions in case study formats. So that would be about 50 case studies that are already ready for you to look at. And our standalone items will be released near the end of the year. So we expect to have about 75 of those. The one thing that I wanted to mention is that we have put together specific YouTube presentations that go through every single new item type. And those will be presented starting in about a week or two on our YouTube channel. So make sure you tune into that. It's free. No reason to not watch it if it's free. So that goes through every single item type and how to use it and how it is scored. So for the person that asked about the bow tie question, I don't have a picture of a bow tie here. We have pictures of those on our website at nursing.uworld.com. So go, and we've got demos there, we've got everything there. But if you'll tune in the next week or two, we'll start a series of YouTube presentations that go through one item at a time. And we show you what does the item look like in very simplistic terms, like for a multiple choice question. Which of the following is a stop sign? Pick the one that's right. And then we give you a question with content in it so you can see what it looks like with the content. And we do that for all of the new NGN item types that are going to be introduced into the exam. So make sure you tune in for those. They're short. They're really short. They're just, a presentation per item type. So shorts to the point. I think that's pretty much it. Do we have any questions that have come in? Nothing? Okay, well, thank you so much for joining us. It's been a pleasure. Please stay tuned and watch for us. We will be presenting a lot of different YouTube videos moving forward. They will be free, and you can learn a lot. So thank you again for your time.